Hey everybody, my name's Eric Woods. I'm a student nurse from Cedar Crest College. I'm going to be presenting my poster presentation of effects of multi-component interventions on falls. So, the significance of the problem, falls currently complicate about 2% of hospitalizations overall in the United States. Costs can reach up to $13,316 in treatment as an adverse event from a fall. Families are affected by this as well, obviously, and some patients may need an increased level of care after their hospitalization. So this leads me to my PICO question. In hospitalized adult patients above the age of 18, do multi-component fall intervention programs decrease the incidence of falls? So, process of literature search. The databases I used were EBSCOhost and Google Scholar, and the keywords I used were falls in hospitals, nursing and falls, fall intervention strategies, and falls in acute patient units. So, limitations on these searches were from the years of 2011, 2019. This was mainly in the United States, and I mainly searched for nursing journals. So, the initial results yielded about 200 articles, and 8 articles were selected for closer review, and then 3 articles were selected for my evidence synthesis. So this just brings me to my synthesis of the evidence. So Leone and Adams are 2016. So the title is Safety Standards Implementing Fall Prevention Interventions and Sustaining Lower Fall Rates by Promoting the Culture of Safety on an Inpatient Rehabilitation Unit. This is from Rehabilitation Nursing Journal. So the purpose of this was to examine how nurse leaders can reduce the number of patient falls. The design of this was a retrospective analysis of quarterly fall rates in comparison to implementation of fall prevention programs. So the sample was an inpatient unit, and it was a 61-bed unit in a 1,070-bed hospital, and it was an inpatient rehabilitation hospital in Michigan. So the results that they found was that all fall prevention interventions initially worked, but they overall failed to maintain a decreased incidence of falls. So my next one is by Mikey Lai et al. It's from the Annals of Internal Medicine. It was a systematic review, so it was pretty good to use. The instruments used were Morse Fall Scale, St. Thomas Risk Assessment Tool, and it was a supplemental search focused on random controlled trials in PubMed and Medline. So they found that inpatient multi-component programs were the most effective in decreasing the incidence of falls. So my last article in the evidence synthesis was by Titler et al. It was from Applied Nursing Research, and it evaluated the implementation of evidence-based fall prevention programs to patient-specific risk factors. So I found this useful in the fact that they targeted certain patient populations versus the other ones, which were kind of more broad. And they found that fall rates declined 22% over their time that they did the study. It was a good quality, and the recommendations for this is that clinicians must know each patient's risk factors for falls and properly assess them. So my recommendations. Interprofessional staff education and regular meetings are definitely necessary for each patient to receive the highest level of care possible. And we'll see that in the clinical setting as well. The development of screening tools for patient-specific populations is necessary to tailor each intervention program. And this encompasses the multifactorial, because each diagnosis will yield different results for each assessment, each diagnosis, and then planning and implementation. So my last recommendation is to utilize the functional independence measure score for hospitalized adults with a high risk for falls. And this brings me to my conclusion. In hospitalized patients over the age of 18, it was found that multi-component fall intervention programs are effective in decreasing the incidence of falls. And falls are obviously preventable if resources are utilized the best way they can be. Last, and probably most importantly, nurses will gain confidence and increase their skill of care with proper management of falls. So this could be with certain assessments, diagnosis, planning, and implementation. As you can see in the bottom left corner, my references are there for you guys. So thank you for watching my video. Have a good one.